Keeping a child safe is the #1 job that a parent has, and the emergency room really is designed to take care of kids when either the pediatrician is unavailable or if a sudden illness or injury occurs that requires a more emergent evaluation of a child. Most of the time, parents bring their children to the emergency room in their car. However, there are certain times when you probably would want to call 911. For example, if your child is unconscious, if your child is bleeding profusely, if your child is having difficulty breathing, or if there's a sudden dramatic behavioral change where you think it would not be safe to bring your child in the car. In any of those situations, probably a call to 911 is a better way to go. Parents know their kids better than anyone else, so they really do need to trust their judgment when it comes to making a decision of getting emergency care for their children. Erring on the side of caution is always the right thing to do. If you've got any questions about when to bring your child to the emergency room, if they need emergency services, parents could always call their pediatrician and discuss it with them. But if their pediatrician is unavailable, then they should always consider coming to the emergency room or, in more severe circumstances, dialing 911. There are actually some important differences between a pediatric emergency department and a general one. A pediatric emergency department is going to be staffed by pediatricians or emergency medicine physicians who are specially trained in pediatrics. It will also be staffed by pediatric nurses. And this is important because in a pediatric emergency department, we really do understand the physiologic differences between kids and adults. At the Pediatric Emergency Center, we take care of patients from infancy through age 17. If your child is 18 years of age or older, they'll be taken care of in the main emergency room. At Suburban Hospital, if your child arrives by ambulance and is severely ill or injured, they will be brought immediately back to pediatrics for an urgent evaluation. Otherwise, when your child arrives at Suburban Hospital, they will sign in and be evaluated by a triage nurse who will determine the level of seriousness of your child. And then after that, they'll be evaluated by the nurses and the doctors on the Pediatric Emergency Center. Sometimes you actually will get lab work or x-rays before even seeing the doctor. This way the doctor can get a sense of what's going on with your child and be able to facilitate and expedite their care. At the Suburban Hospital Pediatric Emergency Center, we have relationships with specialists in our community, such as pediatric neurologists, cardiologists, allergists, endocrinologists, and orthopedists. If your child comes to the Pediatric Emergency Center and it's determined that they really need to be admitted to the hospital overnight, we have an ideal situation where our inpatient area is located within the same space as the emergency area. This way, inpatient stays are facilitated and streamlined, and you're taken care of by the same doctors and nurses that saw the patient in the emergency room. Once the patient is admitted, the doctors and nurses stay in close touch with the pediatrician, and we call and give a status report every single day. In situations where a higher level of treatment is needed, then we will always arrange transport of the child to another facility in the area. When a child is ready for discharge from the emergency center, we give the child and the parents very specific instructions on what needs to be done, medications that need to be taken, as well as any next steps that need to happen. We also really encourage the child and their parents to follow up with a pediatrician within the next few days. And we always coordinate with the pediatrician at discharge in order to make sure that they know exactly what went on while the patient was seen in the emergency center. Having a pediatrician is a really important part of continuity of care for children and their families. In instances where a child does not have a pediatrician, we will always refer them to a pediatrician that we know and trust through Suburban Hospital.